Hello, this is Dr. Marzban from CIC, Complete Injury Centers, and we would like to talk about uh, auto accident and PTSD associated with it. And PTSD refers to post-traumatic stress disorder. And PTSD is not only associated with the auto accidents, but also you have, I'm sure, read about PTSD associated with the um, soldiers and other type of traumatic events and that the people were involved with, like, for example, death in the family or emotional stress that someone had because of the family trauma. And in this type of traumatic stress is not only emotional, it could be physical, and but emotionally, patients are responding to it, to those mindset, and remembering the events that happened some times ago. But the thing is that this emotional response will also affect the physical responses, especially endocrine glands. The article that we are interested to review, it is from the journal Professional Psychology Research and Practice. It is published in 2008. It is not very recent, but it is a good reference to refer to for this subject. And the title is Assessment and Treatment of PTSD After a Motor Vehicle Collision. And this paper talks about assessment of the PTSD, which is important to do, and the type of treatments that the patients can receive to deal with that type of disorders. And as this uh, abstract is presenting, is that PTSD is psychological problems. But as I mentioned just a few minutes ago, the psychological problems can lead to functional problems, and vice versa. And the paper talks about the treatments, and it also talks about the different levels of the stress disorder associated with the trauma. And if it is recent, which is called acute, it is much easier to be treated. And if it becomes chronic, then the problem might be more difficult to deal with. PTSD, which is always associated with some type of anxiety, and this anxiety is referred to remembering or something that mind is connected to the traumatic events that the patient was involved with. PTSD has signs and symptoms, and assessing the patient to see that what type of signs and symptoms are showing would lead us to diagnose the patient more accurately, as well as what type of treatments the patient can receive to maximize the effect of the treatments to help the patients. And these patients sometimes with re-experiencing the type of trauma, it surfaced the issues, and the thought and remembering the events, it brings the um, that type of stress back to the patient. And the numbing of the emotional responsiveness, which means that the patient becomes indifferent to the environment. And there is a problem with the type of arousal, which referring to the sleep and restfulness. And these patients are having difficulty to maintain that. Usually this type of patients will end up, not always, to substance abuse, and therefore in a chronic um, case of the PTSD, it is likely that the patients will um, refer to using those substances to numbing and the symptoms, and having some relief of mind, to be rested and not to get into the depth of the problems associated with the PTSD. So basically, substance abuse, numbing the brain and mind and thought, and preventing the thought not to go back to those memory of the events. Uh, it helps, and again, it is not the solution. Again, PTSD, when it becomes chronic, it becomes more difficult to be treated, and there's got to be more um, deeper uh, type of symptoms, and more aggressive type of symptoms may surface, and emotionally, and also later time functionally, and therefore it is much better to uh, have that PTSD diagnosed and assessed at earlier age of the symptoms, and in order to be able to have a better chance of recovery. This disorders, and which is post-traumatic, it has some type of symptoms and signs, the fear and nightmares, avoidance, memories, anxiety, phobia. There are a whole bunch of symptoms and signs that patients can experience. And again, as I mentioned earlier, is that it is not only the patients which are involved with the auto accidents, but any type of psychological trauma can lead to those type of disorders, like veterans, that they have some type of flashbacks of the events that they were in, and unfortunately, uh, I might call it, they're trapped in those memories, and therefore it is very important to uh, be untrapped by any means that would help the patients, because it is a devastating scenario. If the patient was in auto accident, in this case that we are talking about, they will have physical pain due to the trauma, physical trauma that they experience. If that is the associated with the physical trauma, as I said it before, PTSD can be either physical trauma, emotional trauma, or combination of the two. In a type of auto accidents, it can be one, and it could be a combination of the physical and emotional. So if it is the physical pain that the patient is experiencing, it would get to the part of the brain, which is the parietal lobe, which deals with the somatic sensory perception. And that type of pain become experienced. But at the same time, with any type of trauma, sympathetic, which is the machinery and system that deals with the fight and flight, to help you with the type of stress scenario and environment to get you adapted to the area, to that case, at least for a short time, which is beneficial. But when it becomes the chronic, then it becomes problematic. When the patient feels it, it is going to be understood and dealt with. Frontal lobe that is a commander center. It deals with the planning and dealing with the response to the emotion, and that becomes a mental pain. And the parietal lobe also has access to another area of the brain, which is the temporal lobe, and it has the area which is called amygdala, which deals with the fear, and it has another part that is called the hippocampus. I'm sure you heard about that. That deals with the memory. And again, with the patient that is in the auto accident, the fear of that event and the memory that they are stored in the brain, it will be something that the patients need to be dealt with emotionally, and have the way of um, uh, treating that type of signs and the problems by himself or herself, or by some type of uh, professional help that they can get. Not only the parietal lobe will send it to this temporal lobe, also the frontal lobe has also a doorway to get to this area of the brain. And so the temporal lobe is bombarded at the short term and long term. And when it becomes a chronic, then this area right here becomes very powerful, which is going to take over the brain function and everything else that is going to follow that. Again, we talk about the physical pain. Then with the vision, the patient is going to see the event, or even hearing with the type of explosion in the case of the veterans, or in the car accident when the car is being hit. That type of sensory also can get to the different parts of the brain, and again, it makes this scenario of the chain of the connections even stronger, and make the temporal lobe become more powerful. When that happens, the temporal lobe has the great effect on area of the brain which is called the hypothalamus, which is the endocrine center as well as the autonomic nervous system center. And those, the ones that I mentioned earlier, that is the functional response, and therefore different type of glands and the system, autonomic nervous system, they are going to be affected negatively by the temporal lobe after they are experienced with uh, the type of the trauma that they were involved with. And therefore, the hypothalamus, which deals with the endocrine autonomic nervous system, and it is the area that try again help the body to be coping with the trauma, physical and emotional trauma that the patient has been experienced, and then the hypothalamus is trying to deal with that, so the patient is going to have some type of positive response to it. But when the temporal lobe becomes so powerful, the function of the hypothalamus becomes over exaggerated, and that is the time that the problem is going to surface and becomes out of control. The endocrine of the system of the hypothalamus is controlling the pituitary gland, which the pituitary gland, by some type of hormones that they release into the circulatory system, which means that it goes to any part of the body per se. One of the areas that they go is the adrenal gland, and the adrenal gland receives that hormone via the portal system of blood, and then the adrenal gland, the cortex, because the adrenal gland has two parts, cortex and medulla. Medulla more inner part, cortex is the more outer part, and the cortex is going to respond to the hormones from the hypothalamus via the pituitary gland and the portal system. Then the cortex is going to be, the adrenal gland cortex is trying to release its own hormones to help the body as much as it can. But again, having too much of that, or having too much of anything, it is harmful. And one of the harm that the cortex, adrenal gland cortex hormones can have in the long term, it is affecting the temporal lobe to even become more powerful, and more powerful in the case that they can affect the rest of the body. And at the same time, it is going to make it weak, not to be having recovery. So the temporal lobe becomes weaker to recover, but at the same time, it becomes stronger to have the effect on the other parts of the body. Well, we talk about the sympathetic nervous system response to the physical pain in this case, but also sympathetic nervous system will respond to the mental pain. And the sympathetic nervous system, when it becomes activated, then this system will affect the inner part of the adrenal gland, which is the medulla. And then medulla releases its own hormones, which is epinephrine. And epinephrine, it is dealing with the controlling many types of cells in the body. And one of the areas that they control is the integrity of the gut. And therefore, when that happens, the protection system of the gut becomes weak, and therefore a weak gut becomes leaky, and is like having weak hose. And in weak hose, it is going to have the perfusion of the different substance of water and whatever it is that passes through the tube, then is going to leak out rather than to go to the end and be flushed out. So the leaky gut, it causes the infiltration of the chemicals and other substances that should not be getting into the body from digestive system. It will, after over exaggeration of the activity of the adrenal gland medulla via the epinephrine hormone release, which is going to be affecting this part of the body. But again, as I mentioned before, when hormones are being released into the circulatory system, it can go to any place that blood goes, and even farther via diffusion. The sympathetic nervous system, not only by adrenomedullary hormones, but also sympathetic nervous system by itself has the effect on gut. And then if the sympathetic nervous system is out of control, then gut becomes out of control. Then the perfusion of the gut becomes even greater. And when the leaky gut happens, the we have again feedbacks going back and forth. Temporal lobe will have effect on the sympathetic nervous system in the brainstem, which is the older part of the brain, and then we have a feedback that comes back from the adrenal gland hormones back to the brain. And then we have another system that is called parasympathetic, which is rest and digest type of system, which is opposite to fight and flight. And this is the calming center, which helps with the body to deal with the restfulness of mind and body. And when that happens, the parasympathetic becomes weaker and the sympathetic becomes stronger. So in the long term, the this area right here, the temporal lobe, which has the memory center, which is called the hippocampus, then it has the potentiation to even become stronger in the way of memorizing and retrieving the past memory. And therefore, this temporal lobe centers will keep going on and on and on, and until it has to be either dealt with by professionals or it has to be, some way or another to be under control. But again, if the professional help is not helpful or is not being sought, therefore the patients will end up to use the substances that would even further negatively affect the mind and the body. But in the short term, they are becoming addicted, and that addiction is gives some type of relief to the patient, and then over time, and that acute usage of substances, then patients become addicted and becomes long term. At that point, then it becomes very difficult for the patient to get away from substance abuse because they're so addicted to those in order to have some type of normality in their life. And so that is very, very dangerous. Brain has many wheels, and the wheels will turn and turn and turn. One affects the other one, and the other one affects the other one, and goes back and forth. And and if one of the wheels become affected, then the rest of the wheels become affected as well. And so improving this rotations and the mindset is very, very important to be smooth, and because this area, which is the brain, affects the whole body, and so it is dealing with the emotional response as well as the physical response. Here is the area of the brain, and it shows we have hippocampus and amygdala that we talk about. And here is the area that is the frontal lobe, that is the motor center, is your cognition. Here would be the area that receives the information from sensory, like the vision, your physical pain, your hearing, and all of those will have some effect not only to the frontal lobe, but also in the temporal lobe, hippocampus, and amygdala. So there are wheels of factories which are running, and it should be running smoothly accordingly. But with the trauma that the patient experienced one way or another, such as the motor vehicle accident, the wheels become affected, and then the whole brain function then become out of control. So we have the wheels in this case, and they need to be balanced and work together, because the balance of those wheels brings health, and those wheels, some of them are dealing with emotions, some of them are dealing with the thoughts, some of them are dealing with the movements, and as you notice from this figure, there are so much overlapping among them, and so it is not 100% distinct area of the brain that deals with one or the other, and they're overlapping and they work together. Without accident, and that brings the physical and mental stress, and then this health can be affected, and therefore the patient shows signs of disorders, and that is something that the professionals in different areas need to assist the patient, and what needs to be done for the patient to get the relief. And when that happens, it is better to get the care at the earliest time, because when that turns from acute to chronic, then it becomes very difficult to deal with it. Here are the wheels of the brain. Hippocampus that we talk about deals with the memory. Neocortex, which is the newer part of the brain, is the higher function that deals with the different type of functionality, like the perception of the sensory, motor command, planning, language, and all of those, they can be affected. And therefore, for assessment, it is very important to not only dealing with the sensory perception, but also to deal with the moral output, like their language and reasoning, and the different type of output mentally. But again, as it was said in the previous slides, the dysfunctioning of the brain can cause the dysfunction of the body. Amygdala is another wheel that deals with the fear, as we talk about that, and fear is associated with the emotional response. Prefrontal cortex is your cognitive area, which is in the front of the front part of the frontal lobe, and that is what makes us us, and that is very powerful, very helpful for someone who wants to have a normal life, but at the same time affecting the wheel, the prefrontal cortex wheel, and damaging it, it would become very devastating for the livelihood of a patient. Cerebellum, we didn't talk much, and cerebellum is also can be affected by physical stress, and but at the same time, cerebellum is very connected to the frontal lobe, and this is very, very important wheel. Is very old wheel, and this is very new wheel of the central nervous system, and therefore the older one it becomes the power that works behind the screen and in front of the screen is the prefrontal cortex. So what goes behind the screen is very important. How the system in front of the screen can present. So here are the wheels that need to be working at different levels together and in synchrony to bring the health. And here are the types of treatments and suggestions that the paper brought us, and it needs to be assessed, and and after that, with the consultation and also biofeedback and different types of mental exercises. And there are different types of therapies that deals with the cognition, and again, psychotherapy that helps with the patient to connect to the problems and help themselves in order to get away from that trap. And again, there are going to be so many referrals that the patient will have, and because every professional treatment has its own area to help the patient with the symptoms and signs that they have. And with the PTSD, usually it has physical stress, and that physical stress can affect the mental behavior. And also, we said that some auto accidents can have mental stress due to the sensory perception that they have, either visual, physical, or hearing, auditory. They all can add up to make the PTSD even farther, more complex problem. And PTSD treatment suggestions on this slide, we need to have the correct movements. And these movements is not only the physical movements that I am trying to say, it is also mental movements, because they are very connected. And as you know, and possibly you have experienced, if your mental stress is out of control, then you will have a problem with the physical performance. And giving a simple example is the professional athletes that they need to be in control of their mind in order to perform their best. And so these movements, physical or mental, and they are again under different types of chemicals, which we call neurotransmitters in the brain. And one of them is the serotonin, the other one is the dopamine, and the other one is the norepinephrine, and there are a whole bunch of others. And they are helping the brain to become healthier and work together to bring a good health not only to the brain and eventually to the whole body. And in order to improve the mood, we need to deal with those neurotransmitters, the pain, memory, and eventually the health. So there are different neurotransmitters that need to be uh, under control and have the optimum release in balance uh, in order to bring the health back to the patient. We talk about the drug abuse, and here is the dopamine that is the chemical that brain makes it normally, and in the type of the stresses, this imbalance of serotonin, norepinephrine, and the dopamine, the patient is going to rely on external chemicals, which are the drugs, in order to substitute the deficiency of these chemicals. The goal is pain-free, and the pain in this case that I have on this slide is the physical pain. And we also mentioned that physical pain and mental pain, they are not separated, and they are working together. And in order to help one, you need to help the other one. And here is the pain-free, and one thing that helps the patient to reduce the pain and have a better um, uh, feeling and easing their pain is the treating the spine misalignments. Patients, they usually have experienced strain some type, and especially the spine. They have with the pain and trauma, they have inflammation, and the joint pains of the patient is complaining and suffering. Soft tissue and hard tissue injuries that are associated with the auto accidents. And this type of pain to be dealt, there are different types of treatments beside the medical intervention, which is the surgery, medication, and other type of medical supports. Then we can offer the passive and active therapy, and with the manipulation to reduce the pain that the patient has, and therefore bring some type of relief. And this type of therapy right here, passive and active therapy and manipulation, to reduce the pain, brings the patient to become less depending on medical intervention as far as the drugs goes, or unnecessary surgery that the patient can get away from them, getting the therapy from other means. The important thing for for us, at least, as a therapist, and is that we would like to have the optimal movements. And so this is one of the assessments that we have to measure in order to see that how our treatments are doing for the patient. And improving of movements is the key for us. And because improved movements, better movements, it is an indication that the patient has a better physical activities, physical performance. But the thing is that the physical balance and improving the health, it helps with the improving the health of brain and mental and emotional response that the patient is experiencing in the PTSD. Finally, we reached the last slide of our presentation. It is important that the patient obtain the best therapist that is or are available to them, because this is a very serious disorder, and therefore search around to see that who would be the best care center that can help you out, and again, help yourself and help your loved ones who are experiencing this type of disorders one way or another, not only because of the auto accidents, or it could be any type of trauma, physical or emotional trauma that they might be having experience of, and therefore it is our duty to seek for it, as well as for us to give the best treatment that we have availability for, and to get this disorders to be under control. Again, thank you so much, and you have a wonderful day.